The number of people affected by vascular dementia. Patients with vascular dementia may have from 6% to 30% of the presence of dementia. Vascular dementia is the second most common cause of dementia, accounting for about 20% of cases. The symptoms of dementia can vary, depending on the type of dementia a person has. Vascular dementia makes up about 10% of dementia cases, and frequently occurs after a stroke. The symptoms of dementia can differ depending on the cause of the dementia and the stage of the disease. When the cause of dementia cannot be treated, the focus of care is on helping the person with their daily activities and reducing symptoms. A person with early warning signs of dementia. Changes in personality and social behavior are common to all types of dementia, and in the early stages of the disease most people will start to notice subtle differences in the behavior of their loved ones. In the earlier stages of dementia, there are several signs, symptoms, and problems that may be seen. Changes in mood, becoming increasingly depressed, fearful, suspicious or anxious can also be a sign of dementia. One of the subtle signs of early dementia, in some instances, is an inability to comprehend visual images. Disorientation may appear in not being able to keep track of time, not being able to recognize familiar people, or getting lost in familiar places. As the disease develops, memory deteriorates further, with names of loved ones harder to recall. The symptoms of the disease. Different types of dementia are associated with particular types of brain cell damage in particular regions of the brain. The buildup of beta amyloid in the brain produces plaques that are one of the hallmarks of the disease. As the disease progresses, early symptoms intensify, eventually affecting the ability to communicate effectively and function independently. One of the most commonly reported symptoms of dementia in dogs, and one of the easiest to recognize, is a break in their normal behavior around sleeping and eating habits. Although there is no cure for dementia, treatments are available that alleviate symptoms, and the earlier the condition is diagnosed, the better such treatments work. Many scientists believe the best hope of progress, maybe the only hope, lies in detecting the disease early and devising treatments to stop it before brain damage becomes extensive. Services provided by home health care. Aging adults who require assistance with the tasks of daily living can benefit from reliable in-home care. Whether your parents are still full of vitality and energy, or are more sedentary and receiving home care, or even 24/7 care, you are bound to want to take them out and about in Manchester. Assisted living facilities may be appropriate if your loved one needs more care than the family or individual is able to receive in the home, but not necessarily complete nursing care. When 24-hour care either at home or in a skilled nursing residence becomes necessary, Medicare begins to pay for additional services. Medicare does not pay for adult day care, and offers only limited coverage for in-home health care. Depending on your needs, additional services like medical social services, durable medical equipment, medical supplies, and other in-home services may also be covered. A series of dementia care certification programs. Clinical trials are tests to find out if new medications or treatments are safe and effective in people. Always advise your doctor of any medications or treatments you are using, including prescription, over-the-counter, supplements, herbal or alternative treatments. You can expand your horizons and, more importantly, keep your brain in good working order. Having a signed will in place soon after diagnosis, if one is not already present, is vital. There's nothing home with needing to just unwind and veg out, so to speak, after a long day. When you make the appointment, ask if there is anything that needs to be done in advance, such as fasting before certain tests. Research in epidemiology of dementia and AD. A person needs to have at least two types of impairment that significantly interfere with everyday life to receive a dementia diagnosis. Although anticipatory grief may help the family, the dying person may experience too much grief, causing the patient to become withdrawn. Complicated or unresolved grief may appear as a complete absence of grief and mourning, an ongoing inability to experience normal grief reactions, delayed grief, conflicted grief, or chronic grief. Customizable email reports can be configured to send you your stats daily, weekly or monthly. The person may realize something is wrong and, living on their own, has begun to use strategies to disguise their difficulties and help them cope. One who avoids any reminders of the person who died, who continually thinks or dreams about the person who died, and who gets scared and panics easily at any reminders of the person who died may be suffering from a post-traumatic stress disorder. A diabetes clinic. Always seek the advice of your healthcare provider with any questions you may have regarding your medical condition. Every once in a while, try closing one eye and then the other, Dr. Berdahl says. You do not have to use Medline Plus Connect exclusively to link to patient education information. Future research is focused on early detection of the condition, so that it may be slowed or even prevented. Experts have the answers to all of your mammogram-related questions, so you are prepared and relaxed at your first appointment. You may forget the name of someone you just met, or you may misplace things more often. No specific disease related to dementia. An early identification of symptoms could help in the early diagnosis of the underlying cause. Either short-term or long-term memory may be affected, although short-term memory is typically affected first. Age-related forgetfulness occurs because the brain is aging and changing, just as the body changes. Whether or not you decide to use HRT, there are some easy ways to help improve your memory at home. The column does not constitute medical advice and is not meant to diagnose, treat, prevent or cure disease. With treatment and early diagnosis, you can slow the progression of the disease and maintain mental function. A move to a senior living community. Conversations with a senior in the early stages of dementia may take longer than normal. The only way to find out if the facility meets your needs is to visit it and know what to look for. To help you cope with caregiving responsibilities and to manage your stress, it is important that you remember to take care of yourself. From the time you first began to notice the early signs of dementia, you have probably found yourself wondering how you would know when it is time to consider moving a parent to memory care. The most striking symptom of the dementia associated with Alzheimer is the loss of memory. Spring has arrived, and if you are a caregiver to a parent or senior loved one with dementia, you may be ready to get outside and start enjoying some spring activities with them.